Welcome back, ladies and gentlemen, and as promised earlier today, we have a very interesting discussion in the studio, and we're delighted to be joined this afternoon by our guest in the studio, Dr. Gamila Muhammad, the head of the cardiology department from Suez Canal University. Dr. Gamila, thank you so much for joining us this afternoon.
It's a real pleasure to be with you.
Thank you very much. Thank you so much. Yes, we finally meet face to face, doctor. Now, the second wave of the COVID-19 pandemic obviously has hit Egypt, but we are already seeing a decrease in numbers, unlike lots of other countries, whether European or the Americas, etc. What do you attribute this to?
Thanks God, Egypt has, did a lot in the field of preventive cardiology, and we are talking about prevention. The health, the state of health means prevention, and then prevention. So there are many initiatives that were taken by the government and, Egypt as well, and it was chaired by the President Abdel Fattah al-Sisi, where we had a lot of initiatives. All of them were dealing with risk factors, and as we know, it was very prevalent that they tackled how the health style of the people, how the lifestyle changes, the dietary habits. They looked for the diabetes, looked for the hypertension. So this was an ideal platform for the Egyptian to change their lifestyle and be able to adopt to the lifestyle changes and the precautionary requirements needed to combat the COVID-19. So thanks God, this is one of the factors. Maybe the other factor that there was really good planned, well-planned steps from the government, and as we can see that the Prime Minister was very sharp, and he was very, as well as the Minister of Health, being able to put very reasonable steps for the management of the COVID-19.
We've also seen lots of different approaches, as you said, and initiatives, one of which was to monitor COVID patients who are self-isolating at home and send medical teams to check up and treatment and the whole package, really, the protocol, as they call it, to these patients. How did that also help this home monitoring of patients or people with COVID-19 in limiting the spread and decreasing the number of people that go to hospitals, that seek medical attention in hospital facilities around the country?
Actually, lately this initiative was, amazing, because it enabled that the health system will be still very powerful, still able to, take care of the very serious cases. So this was very good step, I think, and maybe also at the same time it was able to isolate those people who are having COVID-19, so they were actually should stay at home, be isolated. The packages, they receive the drugs in their due time. So there is no spread of infection everywhere. So it was just, I think, it was an enormous step that helped a lot.
Absolutely, absolutely, Doctor. Now, on the second wave of the COVID-19, lots of people say this time round it's different. It's easier to diagnose. It's got different symptoms. Lots of people complain, for example, from GI. It's no longer the headache, the extreme temperature. Other people there isn't that cough that was with the first wave, etc. Is it true that the symptoms have changed in the second wave?
Well, actually, I myself, I don't think it has changed dramatically. It just, the mutations of that virus not dramatically changed, because also I think the symptoms is still the same as we know, the fever, the cough, the dry cough, the loss of appetite, the loss of smelling. To some extent there's some GI symptoms, as you have said, but I think there is no dramatic changes regarding the symptoms, and
so it's pretty much the same as the first.
I think it's to a big.
How about the new variant, Doctor?
The new variant we
come up in Britain and South Africa.
We are dealing with a virus. A virus is a monster, and as you can see, the virus is changing ever with mutations all over. Maybe I think in the COVID there was no much mutations. There are many other viruses who had gone a lot of mutations, much more than this. So I think the mutations are not that bad, and we hope. I have to say something very important, that we have to say that is the main weapon against the COVID-19 and any other virus infection will be the change of lifestyle. So you should just keep your life healthy. You should sleep an ample amount. You should sleep at night. You shouldn't, spend the whole night, in front of TV. Healthy foods, a lot of vegetables, a lot of food, fruits. Take a lot of antioxidants, a lot of plenty of water. Fish may be helpful. Avoid too much sugar. Avoid too much, salt.
Soft drinks. Yes.
Yes.
Let me ask you something else, Doctor, related to the virus. Do you see a change in the reception of the news that you are COVID positive? Is it less stressful now? Are people more aware of what this virus means, and it's just hopefully like influenza somehow, like the virus of influenza, that you will get it and you will fight the symptoms with your immunity and eventually you will be cured of it? Are people more well educated about
yes,
this
definitely,
virus?
definitely. If you ask anybody, any Egyptian now, what is about the corona or the COVID, they will know. But I hope that they shouldn't, underestimate the severity of the situation,
Yes,
and they are, less sticking to the precautionary measures, and we hope this will not be okay anymore. They become acquainted to the virus, and this is not very good anymore. I think we need to stress more that you have to support your immunity.
Right, let's talk a bit about the vaccinations. There are several kinds of vaccinations that have been approved, and some of them have already started arriving in Egypt and have been indeed given to medical practitioners and people with high chronic illnesses, etc. How do you see the vaccinations? What do they mean for this virus?
There are treatment if you are going to have a disease. You have just drugs to get rid of the disease, and you have vaccination. This is to raise your immunity so that you can be able to face the disease. It is, so this vaccination is not true drugs to treat.
It's not a treatment.
Virus. And this actually the case for all viruses is not just new. So the whole world now is trying to get vaccinations. Of course, we know that the vaccinations available in the whole world have gone through steps, which is emergency track,
fast track.
Emergency fast track. This is very important, and that actually, thanks God, Egypt is it's on its right way, and maybe the vaccination importance is for those very liable to get infections,
like medical practitioners,
professionals, above 60s, those having chronic diseases, and so on. So, but I have to say something very important. It is not the only way to combat the infection. It's just one of the maneuvers, and it's one of the maneuvers to raise the the preventive attitude in the community, to raise the immunity of the whole population. So I suppose it's important. So in some populations, but actually we have to stick to the precautionary measures very quickly and take it as a solid background.
Prevention is always better than treatment.
Yes, if you are talking about the WHO criteria for definition of health, it says prevention, then prevention, then prevention, and last comes the treatment. So I think we have to take the preventive measures, and we have to think, very important, it is a virus.
Yes.
It's a virus. It's changing to keep its existence. So this is very important.
Absolutely. I'm afraid we've run out of time, and very quickly this time, I'd like to thank you very, very much, Dr. Gamil.
Very happy to meet you.
Likewise, Doctor. Thank you so much for coming.
The studio of the Now TV. Thank you very much.
Thank you so much, Doctor, Head of the Cardiology Department, Suez Canal University. Thank you so much for coming.
My greetings. Thank you.
Ladies and gentlemen, that's all the time we have for today's edition of Cairo Local Time. We do hope you have enjoyed it. My name is Angie Mehermani. Thanks for watching.